Hi everyone, this is Leanne and this is From the Heart. And today I have an episode with a client who had a vaginal breech birth. She was a first time mom. I was there throughout her birth. And I wasn't there throughout her process of making the decision to attempt a vaginal breech birth. So I'll let her talk about that. But just for the people who don't know what a breech birth is, or what it is that in utero, when a woman is pregnant, the baby has to be either head down to deliver, and most babies are at term head down, and most births are head down. But then about 3 to 4% of women at term will have a baby that is breech, which is means that the baby is bum down. Um, because of research and some uh, biases and then actual follow-up after that, there's been like a really big dip in the amount of people that were delivering vaginally for breech birth, and then it completely stopped. And then with follow-up from the data that they were collecting, they actually showed that long term there might be some benefits for babies that are born vaginally, and that the outcomes of the babies that need a little bit of resuscitation or help with breathing is very short term. The reason why these babies might need a little bit more help with breathing at birth is just because as the baby is being born, the umbilicus gets born before the head. And so then there's just a little, like there's some squishing basically of the cord that can happen before birth. It is a birth where we absolutely like the medical recommendation is just that we make sure that the baby is growing well beforehand. We don't want any placenta issues. We don't want any lack of oxygen getting to the baby beforehand, kind of thing. So so making sure that that baby is growing well is a priority when we're getting close to term. So it does need a little bit, more ultrasound and a little bit more discussion, but it absolutely is an option. And in my very strong opinion, I think that all baby catchers should be learning how to do these skills, and not just in learning how to do emergency skills, but just as a variation of normal, so that we can offer these safe options to clients and not be making these decisions from a fear-based place or like in an emergency kind of thing. So so I have Sachiko with me. Sachiko, do you want to tell us a bit about yourself first?
Yes. My name is Sachiko, and I moved to Ottawa very suddenly when I was 8 months pregnant. So I was 7 months pregnant, living in Tokyo with my husband, and we planned to be there for at least another few years. But then he suddenly got a job in Ottawa, so and we up and moved quite quickly. Um, and when I knew that I would be giving birth in Canada, suddenly I had to make the decision to. Well, I knew I had to find a place to give birth, and I. But the problem is, I wasn't a permanent resident of Canada, and my citizenship is Japanese. So once we learned that midwifery services are free for all residents in Ontario, that's when sorry, is there reverb?
There's a little bit, it'll go, there we go.
Is it okay?
Yeah, it's gone.
um so that's when we're like, oh, we should be contacting midwives. And then we reached out to a bunch of places, and then the place where you were working at was who reached back to us. So that's how I came to meet you, basically. And so I have two kids now, two girls, and we were living in China for a few years, and then we recently returned to Ottawa.
So I got to see you, and then 'cause I always bump into my clients, and then I was like, "Would you like to be on my podcast?" All right. So, like, if you wanna tell us about what helped you prep for your birth, both like how to cope with labor, but also make the decision for yourself to have a vaginal breech birth rather than a C-section, because a C-section is always offered to women who have a baby that's presenting bum down.
Mhm. Well, I would say because I didn't have OHIP, maybe that was a big factor in like, okay, well, like I don't want to be not in the care of midwives when I have my baby. But also I think for my husband, actually, he was like, people kind of talk about it casually, but a cesarean, it's like it's major surgery, we knew that we didn't have family nearby, and we knew that on like a day-to-day basis it would be us. And at the time he couldn't take leave because he hadn't worked long enough. So we knew that like we couldn't make things harder on ourselves. But also one thing is that yeah, the the thing was, yes, the big thing was that right before I was about to leave Japan, I went to to see the OBGYN, and it seemed like I had tested positive for gestational diabetes, but there was no time to follow up on that. And in the time between moving to Canada, finding a place to live, and then going to meet the midwives, like it was very clear that it had become gestational diabetes. And then that made the risk of having to need a C-section even more, so even higher. So for us, it was like we want to avoid a C-section, but like for like the hospital would consistently be wanting us to have a C-section. So yeah, we were for us the large part of like preparing for birth was actually like understanding how we could safely avoid having a C-section, basically.
Yeah. And then like who had the discussions with you to help you make that decisions? Like what kind of information helped you make that decision?
Well, yeah, I think the big part was that once like you saw that it was a breech birth, right? You contacted all of the other midwives at your clinic, and then it was like, from the way I saw it, it was like a team of like people who could handle the breech birth, right? And were equipped to like just not see it as a problem that had to be dealt with surgically, but like it can, like this is something that tons of women have, you can deliver a breech baby vaginally very safely and all that. One big thing was, I remember Betty Ann had the midwife Betty Ann had a kind of like a seminar with another couple who also was expecting a breech birth, and she showed us videos of breech babies being born. And also one thing that really stood out to me was like, even if you don't really know much about giving birth, I think a lot of people have heard about like AGPAR scores. So
Absolutely.
yeah, and Betty Ann was saying the numbers are not going to be high for a breech baby a lot of the time, but like you shouldn't panic because the baby needs a minute to kind of get the oxygen back in the body, or am I saying it? Yeah. So things like that there are so many things that happen with a breech pregnancy and breech birth that are considered negative but are not like insurmountable obstacles. Like that, really just talking with the midwives during that time really gave me strength.
Yeah. So giving you unbiased opinions and giving you the risks and the benefits of both ways that you could go. And you were really lucky in Ottawa. There's Betty Ann Davis, who is the breech expert of like for sure Canada and maybe all of North America. I can't guarantee that, but she during her practice didn't lose her skills when everyone else was losing their skills with vaginal breech birth. And so we're just really fortunate to have like her practicing and offering these skills to women who would prefer, who make that decision. And the other thing, this seminar, like just for the person who's listening, these seminars I think are 4 hours long. They're very, very in depth. And so she talks about the risks and benefits both ways. And then about 50% of people will make the decision to have their C-section. That's their choice, and the risks and the benefits that they prefer. And then the other 50% of people will decide to have a vaginal breech birth, like Sachiko here. And so just it shows the importance of the healthcare provider knowing how to give these discussions and knowing the facts and what people want to hear. Like one of the things that people want to hear is that a vaginal breech birth doesn't have to be, in essence, feel different. It's not more painful or less painful than a head down birth, and like things like that. And Betty Ann like just knows what to say, just to answer the questions that are in like a layperson's mind. And she's there for, even if she's never heard the question, she's there to answer anyone's questions. So do you want to tell us about your birth, Sachiko?
Let's see, like I remember there was like a lot of kind of back and forth between at the hospital, like the OBGYN. I remember going to see the OBGYN because of maybe because it was gestational diabetes and breech. And then they were like, anytime you want to have a C-section, you just come on in. And I remember there were kind of like almost we were arguing our case. So like the birth basically, the original due date had to be recalculated. I think the due date is often calculated because of the last year period, right? And then for us, I think because I had like recorded the date of conception. I remember we actually used that as an argument to go talk to the OBGYN and be like, look, you think the due date is this day, but it's actually 1 week later based on date of conception. So therefore, you are trying to rush us into having a cesarean, but like I think it's too early, basically. So in the end, it was I kind of remember a lot of back and forth about, no, we will not be having a cesarean, and then we will be having the baby like natural vaginally with midwives. So when we recalculated the due date, that became Christmas Eve. And most of the time, right, they say it's like a marker, right? It's not when most babies are not actually born on their due date. So we just went ahead and planned Christmas with our friends in Ottawa. So it was nice because my friends who we celebrated Christmas in Japan the year before were all somehow in Ottawa at the time. So we were planning a nice dinner. And then my friend came in from Montreal. I was greeting him. I was eating, but then my water broke. And my mom was had come to help from Japan at the time. She was where everyone's like, oh, like, this is probably water. You should lie down. And I think, what is it? Because it's a breech baby, you end up having more water gushing out, like than a head down birth, is it?
No,
No, not necessarily. I was like, I just remember like, oh, it just feels like, oh, this isn't like in the movies. It was like kind of like a puddle and a trickle, but not a gush. But yeah, so I was just lying down on the sofa, but it kind of quickly became like really painful. So I remember hiding out in the bathroom trying to go through contractions, and my husband's like, let's not freak our friend out. But like it was really starting to hurt. And then I think that was when it was like, oh, we should call Leanne. And then Yeah, I think basically maybe the labor, I guess, yeah, I woke up and I was like, it kind of hurts. And then maybe like 3 hours later, my water broke. But yeah, so maybe, I don't know, maybe I had been going through a lot of some of the labor while I was asleep overnight. Does that happen?
Yeah, it definitely does happen. Yeah. I remember the call, and it was you were reporting that your water had been broken and that you were just like cramping. And
Mm,
I also I remember that I wasn't sure that your water had broken, so that I was coming to assess you to see if it really was your water that had been broken or not. That's what I remember like thinking on my way to you.
mm. And I think one thing is that, well, with like the birth of both of my kids, the thing I learned about myself is like maybe I have like a fairly high pain threshold. So it was maybe preventing me from like understanding that I was like in active labor. Like, oh wait, forgot to mention, like, there was a point when we tried to turn the baby, at the midwifery. It was like Betty Ann and you and Sylvie, and yeah, there were like maybe 4 or 5 midwives. We had we you know we you had you were all trying to turn the baby like physically, to see if it could be a head down birth. And I just remember like that really hurt. But but like the pain of having contractions was like a completely different pain.
Mhm.
But yeah, just like, but because I was kind of like shouldering through it, um it was like not making me realize that, yeah, I was like probably, dilated and all that.
Yeah. For the person who's listening who might not know what Sachiko is saying is there's this thing that we do. It's called an external cephalic version, where we manually try to turn a baby that is breech head down, and we do that externally. And of course, we make sure that the baby is tolerating the procedure. We're also making sure that the woman is tolerating the procedure. So if Sachiko was in pain, we obviously stopped at a certain point because your baby didn't turn. And I actually don't remember like doing that. Like I don't have the memory of us turning your baby, but I can see why we would turn your baby, and that is usually offered to most women who have a breech birth. Some women do report that it's uncomfortable or painful, and some other women don't find that it is. Um, and an external cephalic version turns, we say, about 50% of babies head down.
Mm.
Um, and yeah, so we were at your birth, your water is broken, and I'm coming to assess you.
Yeah.
Yeah.
And then, yeah, you're like, I'm gonna look. And then I remember just it was like on my bed. And then, yeah, you're saying like there's a foot.
Yeah.
That's
So what I did is to assess a woman if her water is broken, and if the water isn't like obvious on the pad that I see, then what we do as healthcare providers is insert a speculum inside the vagina to see if there's water that pools down into the vagina. And what I saw, like this is the only time I've ever seen this, is because Sachiko really copes really well with labor. And so I put in the speculum and I see that she's like 6 centimeters dilated, fully effaced. And that I'm like, oh, so she's like not in early labor like she looks. And then there was a little lavender baby that I could see, because we don't do speculum exams when someone is, dilated a mundo. But basically, Sachiko's baby is what we call a complete breech. So there was a footling breech is when the feet are up towards the face, and this is like a footling would be. Wait, sorry. Uh, Frank breech would be like this, with like the feet towards the face, and usually like the doll, the feet would be more like this in the face there. A complete breech is what Sachiko had, and that's a baby that's kind of sitting down like this on top of its feet. And what makes it a complete breech is just that the hip is flexed. Both hips should be flexed. And but so what I saw was the feet, like one of the feet, and a little lavender feet and butt. Um, that was that was showing it, and so I've never seen that before. It was like it was cute. Some people who aren't trained in vaginal breech birth, they might consider that a footling breech. But just because there's a foot there does not mean that it's a footling breech. What makes it a footling breech is if the hip is extended like this and the baby is kind of sort of standing on the cervix, which would there's just more risk with that sort of breech birth because there's not a lot of pressure on the cervix, and so it makes the labor's progress not good. And then the other thing is that because the baby's pelvis isn't taking a lot of space in the pelvis, there's a risk about 10%, maybe 15% of a cord prolapse, so the cord kind of coming down before the baby does. But if we have a complete breech, that baby's pelvis is still fully in the pelvis, and that risk is very, very reduced. So anyways, that's what I saw, and I still I've never seen that before, and it's an image that I have that I probably will never forget. Yeah.
So yes, if you're born like bum first, then that's a frank breech. Like
Frank or complete breech, yeah.
okay.
Frank or complete.
Because one thing that made it kind of feel like I could give birth naturally with a breech baby is that I was also a breech baby, and my mom also, had me vaginally, and I think for her, she's just like, I was gonna see your face, I thought, but then your bum came out. I just remember her saying that.
Wow, so they had no idea that you were a breech birth, like when you.
Yeah.
Wow.
But yeah, no, and then after you saw the food, you were like, we have to go. And I remember you started speaking in French on the phone, and I had never heard that. So like somehow like that was more like I was like thinking about that more, and then you were like, but then I remember you had to like drive us in your car, and then you had all these presents in the back seat, because it was Christmas.
Yeah. Just so Sachiko and your partner you guys were like dialing for an Uber, and you were meters dilated, and like I knew like you were probably not very in active labor when you had initially called me, but who knows? We don't know. But and so I was like, and the longest part of labor is until 6 centimeters, and after 6 centimeters it goes fast, and I was like, I need I can't wait for an Uber as well. And I like, just for the car insurance people out there, I've never done that before or after. But I was like, we need to go, and I shoved all the Christmas presents and got Sachiko and her partner in there. Things that sometimes midwives do.
Yeah. And then I remember in the hospital. Oh yeah, and then one thing was Betty Ann was saying, I remember, and I think the other midwives you were saying is like, the whole thing in the movies when the woman's on her back and like pushing, like that's not actually easy at all, because like if you're an animal, you give birth like other animals, so you should actually, be on your hands and knees on all fours. So I was getting ready to do that, but somehow I don't know what it is. I guess one thing I remember about the labor was like I was really, inactive labor for very, very long, and yet I felt a lot of fatigue. So I remember like in the hospital, I was like kind of sitting. I was like sitting on a sofa trying to like go through labor, and I remember the midwives being like, maybe get off the couch, like here, we'll give you a birthing stool, that sort of thing. And I think, and then I remember looking at my records later, and it was like the pushing part was only 10 minutes, I think. But yet I remember like I was like, I need to take a break, and then I think my husband was reminding me, it's like, yeah, this isn't something that you can take breaks for, really. Like, you have to keep on going. So I think, like, maybe someone put a hand inside me to, like, push the head out at the end or something.
Ah,
Yeah.
okay, yeah, that like I wouldn't remember, but Betty Ann does uh sometimes some maneuvers. Sometimes she like so it's just a vaginal exam. It's not the whole hand that goes in. It just might be like two fingers, and then
Mm.
to help you push, she might be because people who have breech births don't necessarily become fully dilated, and that's like really
Mm.
common. And so maybe she was just helping with like that remainder of the cervix to help your baby come down.
Mm.
Mhm.
Yeah. So yeah, and then I think because of that, maybe I had a hemorrhage. So when the baby was actually born, I remember her like coming out of me, but then afterwards, because of the hemorrhage, like I wasn't really in like a place to like, be concerned or anything. It was more, I was just kind of like, I was kind of out of it. And I remember my mother who was in the room saying, "Oh, that's a pretty baby. What a pretty face," or whatever. But later she told me, "Oh, I couldn't tell you, but the baby looked gray and it was like scary." So it was basically just as I had learned during the Betty Ann session, except like for me, I didn't see the baby yet, but I do remember up until gave birth, it was midwives like surrounding me. Maybe there were like five midwives, and it was like it was really really nice. But the second the baby was born, the doctors at the hospital rushed in to check the baby. Yeah, and that became it was like a whole it was like another scene that was running alongside just me. Yeah.
Yeah. What so what happens is like part of the protocol just because of like that squishing of the cord that can happen at birth.
Mhm.
We call in like the a baby's team that comes in. Um and they're just there to like assess the baby basically.
Mm.
All babies are born a little bit of a lavender and blue color, and babies that are born breech can be a bit floppier and need just that stimulation. And correct me if I'm wrong, Sachiko, but I believe that your baby didn't need any additional help, and that the baby stayed with you throughout the whole time.
Yeah, I
Yeah.
feel like maybe I should get oxygen. Like, but no, like I remember I had hemorrhaged so much that I couldn't use my arms. But I do remember like I was lying there and I couldn't hold her, but like somebody was like I guess my husband was like holding the baby against me. Yeah. So
Okay.
she was with me, yeah, the whole time.
Yeah. And then just for the person who's listening, a hemorrhage isn't associated with having a vaginal breech birth. It is there's that like one of the risks of having a C-section is there's more bleeding with a C-section, but it can like bleeding can happen also with someone who's had a vaginal birth, whether it's breech or head down, and that's just what happened for Sachiko.
Hmm.
Yeah. And then how did you what helped you recover from the hemorrhage, Sachiko?
I think initially they were still like, if you can get up, you can leave and go home. And to me, like as a Japanese person, I was just like, well, it was really shocking because in Japan, like the mothers stay at the hospital for a week after birth. And I think it's because in Japan you tend to rear children without as much support from your partner that as like maybe like other countries, definitely compared to Canada, you yeah, your partner isn't there physically so much to help just because they might not be able to um feel like they can try take the time off work, that sort of thing.
Okay.
So, but yeah, I remember thinking, okay, like I guess this is how it goes. And then, but when I tried to get up, like I couldn't. And then that was when it was like, oh, okay, like we are going to need a blood transfusion. Uh, you're gonna need a blood transfusion. You'll probably stay overnight.
Okay.
And then yeah, so I remember being wheeled into a different section and then with different nurses and all that catheter, and yeah, just and not being able to eat, I think, was like hard for me because by that time I was just I remember Sylvie looking at like the blue sheets that to assess how much blood had been lost, that sort of thing. So I had lost enough blood that I was just like everything was just completely cold. That's really all I remember. And but at some point, no, during the blood transfusion, my husband held the baby, but after that, I remember she was like kind of nestled next to me, and it was like I was supposed to start the process of like learning how to breastfeed and getting her used to it. And then while I was doing that, somehow it was really late at night, and somehow my friends who were had come in for Christmas dinner, they had found a way to get past the visiting hours. So they were at my house, they made the food, and then they packed it up and took it to the hospital, and somehow like somebody took pity on them and let them pass through, so they brought Christmas dinner to the place. Um so I was able to eat. Like I remember my husband like putting the food in my mouth like after my blood transfusion, and then my baby was in my arms.
Yeah, just for people to know about the blood transfusion, we don't get people to stand up right away after birth. We like it takes 2 hours, and we do treat people based on like symptoms and also what they've lost. Like I actually, like I remember that there was a hemorrhage, but I don't remember like what happened. And so yeah, like basically we would have stopped the hemorrhage either with like our hands like just like outside, like sometimes we just kind of help put pressure on the uterus, and sometimes we give more medication and we start an IV for people who are bleeding a bit too much, and that usually helps the hemorrhage. The other thing that can stop a hemorrhage is also emptying the bladder, and so that's why Sachiko likely had the catheter inside, but that doesn't always happen to everyone. And of course, if we weren't coping well, we would have kept you at the hospital. And then what makes us decide to give a blood transfusion to a person is we would do blood work before, and then if the blood work shows that there's not a lot of hemoglobin, like it's like at a low level, then there'd be the option of having a blood transfusion. Yeah. And then do you want to tell us like about like the week after birth and your transition after birth, like just into motherhood and breastfeeding?
I remember it was really nice because like I think you visited many times. I know that there were, there's like three visits maybe in the first week, and then but I remember there was a little bit more because I was having trouble breastfeeding. And I don't know if it's because of the hemorrhage or something, but I did have a morning when I woke up and you know my breasts were like, like they were like swollen, and it was like they were really hard, so the milk had come in, but it still wasn't really enough. And there was an issue of I think, I didn't know that, initially if the baby drops a bit of weight, that's considered normal, but after a few days the weight was not gaining back. And then I don't know if I would be so adamant now, but at the time I was very emphatic about wanting to breastfeed. And so after a while, when the breastfeeding wasn't going very well, it was what I was prescribed domeperidone, right? Which is like, was it? It's a off with the side effect of taking domperidone is that it makes you lactate. So it is like, it is so I was taking that for a good while. And then I still also rented a breast pump from the hospital, and it was like, in retrospect, it was pretty nuts. It was like you're supposed to feed every 3 hours. You try to do it for 20 minutes on each breast, and then you spend 20 minutes after that pumping to stimulate it. And then, you do all that, you wash all the parts and all. So yeah, needless to say, it was really nice because it was a white Christmas. It was very beautiful outside, and you wouldn't want to go outside anyway. So you're just inside with the baby. But yeah, the breastfeeding was not going well, and I remember that was really hard. And that was also it was the hard part was later sending photos to my family and friends and being like, and then they would be like, "Has the baby lost weight?" And then I would be kind of so caught up in trying to feed her that it's almost like I hadn't realized. So I guess in the first part, the very first part of becoming a mother was not, yeah, I didn't find it easy.
Yeah.
Yeah.
Yeah. I don't think anyone finds it easy. But yeah, for the person who's listening, if someone's milk supply is on the lower end, the first thing that we do is make sure that the latch looks good, so that we hope that there's like good milk transfer to the baby. And then if there is just a low milk supply and it's the latch or a good latch is not the problem or has been solved, then we just want to do this what we call supply on demands. And so the more that we stimulate the breasts, the more that the milk, more milk will be produced. And so with time, if Sachiko was being seen about every 2 days in the first week, then we would have hopefully, I don't know how long it took you to make the milk that you needed to make. But like hopefully the process of like feeding and then pumping is just it's a transition. It's not something that you do your entire breastfeeding time, basically. Was it for you, Sachiko? Do you remember how long you would have breastfed and then pumped?
I just remember like how long I continued that process of like using the pump and all that. It was a few months. It was I remember going to Japan with the breast pump in my carry-on. My the baby was like 4 months old. So I did do it for quite a long time, and I was taking domeperidone for quite a long time. And I remember my family doctor at some point being like, "You gotta stop."
Yeah, and when was that?
I think it must have been about like even a year old or something. It was like definitely, yeah,
Yeah, that
probably,
makes sense.
yeah, not recommended.
It's well, so there's domperidone, like it's just as so the babies are usually exclusively fed with milk for the first 6 months, and then after that there's you can introduce food to your baby. And then and so after 6 months, like there's still more breast milk than there is food, and then it goes like this with time, like there's just more and more food and less milk. And so if you're still feeding your baby after 1 year and you're still on a like a large dose of domperidone, you would need to reduce that with time. Yeah.
Yeah, but I think, well, for I guess it could have been, like it wasn't for my second baby. It didn't happen like that. Luckily, I didn't need to use a breast pump or take domperidone. So it was, yeah, it did show me that like it did make me feel kind of bad about myself in the first few months of my first child, but for my second child, because it didn't happen like that, it gave me a little bit of comfort at that time.
Yeah. Sometimes having a hemorrhage can make your body just not produce as much milk, and then you had to like work for it more. But yeah, it's good that you said that it didn't happen the second time, because it doesn't necessarily happen the second time either. Yeah. The body just needs to it depends what it would have happened initially, and the having had a hemorrhage is a risk factor of just needing to up the demand, basically. And then I don't remember what your latch was like or anything like that. And the latch is the most important part to try to mitigate
Yeah.
breastfeeding.
I
Yeah.
remember, yeah, you're like, hold it like a football. And I'm like, I'm from Japan. Like, I do not know what that means.
Yeah. So, yeah. So, and then you actually, so like the next question that I have for you is, if you needed to advocate for yourself, but it sounds like you really did need to advocate for yourself with that time that you saw the OB.
Mm,
Because if you're planning a breech birth, it becomes like a team effort, and then we follow these guidelines that are written. And like you kind of really gave good examples of what it turned into, and you were advocating for yourself around your due date. I'm not sure
mhm.
if like the diabetes was an issue, and that they
It
would
was, yeah.
a C-section whenever you wanted to. Uh,
Mhm,
so it does show that some the care providers do have like a preference
mhm,
of what they offer um, when it comes to having a breech birth in it. But if you know in your heart um, what risks and benefits that you prefer, you can like then and you feel that you're well educated, then I'm happy that you stood up for yourself, and you like that you knew basically inside of yourself
mhm,
your decision was going to be. And like at the end of the day, like what I remember, you can correct me, Sachiko, is that the
mhm.
time I was with you until the birth of the baby was 2 hours.
Yeah, yeah, it was very short.
Yeah.
Yeah.
Yeah. And um, uh, so like um, some people might decide to have a vaginal birth, and then at the end there might be a C-section that's recommended later because their progress was slow. But um, that's not that's just the case for maybe I don't know 30% of women, and 70% of people go on and have a vaginal breech birth, um, and yeah, you answered all my questions.
Mm.
Are there any other things that you'd want to like tell the listener, like things that helped you make the decision, or helped you do better, or like not do better, but like gave you confidence?
Well, I think one big, big, big thing is that it had never occurred to me that you could go a kind of say you didn't have to agree with what the doctor was telling you to do. Like, I think because not only did I have a breech baby, but also because of the gestational diabetes, the pushing for the C-section was really, really high. But what was kind of like I'd never yeah, and it had never occurred to me that we could say no. But in order to make the no like actually, an educated opinion, my husband actually read all of the medical what do you call it, the reports that Betty Ann had sent us for reference. Like I just looked at all the PDFs and I was like, nah, I'll read the abstract. But he actually read every single one all the way through, and then he was like, look at all these risk factors that people are talking about. For especially for gestational diabetes, like I don't fit the profile. So why is it being pushed so hard? From the OB side. Um, so yeah, just that yeah, it did really feel like knowledge is power in that sense because I had a gut instinct, but my husband was backing it up with actual kind of facts that he could use as an argument.
Yeah.
And but then also just like I wanted to, when you we would have had to transfer care. That's what I learned, right? When talking with you. Like if I had opted for a C-section or whatever, then I wouldn't be able to have the midwives like around during the labor. And I really, after, being seen by midwives for a few months, I just like I didn't want to do that. Like I wanted the midwives like around. I wanted like the team of women. And I just I knew that in Japan, I never would have been able to give birth surrounded by midwives. Like probably the chance of me being talked into a C-section and being saying yes would have been it's just like infinitely higher. I don't know how much I would have questioned it. But um but yeah, to have people around you who have seen your face, who know your family, like my husband and all that, it just it was like invaluable. It really, I don't think I could have had a better experience in if in really anywhere else, like because it was in Ontario, because yeah, we were seen by midwives. That's what made it really special. And yeah, and because of that, I continued to have be seen by midwife for my second child as well.
Yeah. Um, if you would have had a C-section, what would have happened is that like especially for a planned C-section,
Mm.
you would have went to the hospital. They would have done some blood work and some IVs. The midwife would have showed up. There would only have been one midwife at your birth, but there would have been a whole other team, the OR team, at the birth, and then like one midwife would have been there at your birth. Yeah. But yes, it would have been a transfer of care for the C-section to a obstetrician. Yeah. So it shows that continuity of care matters to you. And
Yeah.
actually through I think it's the college, like the College of Midwives, that see that continuity of care actually really helps women in labor.
Yeah.
So like it decreases the amount of pain relief that women need, apparently. But I don't have that information in front of me, but from memory, that's what I know. And then it just what you were saying about knowledge is power. Like clients really do love having research. So like if they're making a decision about having a home birth, and like Sachiko was not thinking of having a home birth, but at this point, because her baby is breech, but like women really love and the partners really love to look at the research, and that helps them make decisions. And some people will just look at the abstract, and some people will read the whole thing, and it does make you make a more confident choice for sure. If you are in dialogue with a care provider, you can always ask for the studies, and you can also ask for more than just the abstract or more than just the guidelines as well. That's a way that you can advocate for yourself, and that's a way that you don't have to make a decision right there at the appointment. You can make the decision later after you've read the information as well.
Mm-hmm. And having all of that knowledge, and going through that experience with, the midwives and also the hospital, is like it gave us so much kind of confidence in a way that for the second baby, we did end up having a home birth. Because because of the hemorrhage, I knew that the birth center wasn't an option for me. But I remember the midwife being like, well, because of you had, ABC for your first birth, you can't do the health center, but you can actually do a home birth. And we had literally never thought about that. But then, going through all we had learned, we're like, oh yeah, we can do that, and that ended up being really cool too.
Mm-hmm. And like from what I hear is that you would never have made it to the birth center or the hospital either. Yeah. Yeah. Uh, yeah. The birth center just needs to be a little bit more. They just are more conservative, and yeah, your midwife with you can tell you what she's comfortable with, and then the midwife that you had for your second birth was at. The midwife that you had at your second birth was there at your first birth too. So, and she's the one who was actually like managing helping you with the stopping the hemorrhage basically. Like she knows because she was the one that was more involved with that, what she was comfortable with. Yeah.
That's true.
Yeah. That's really great. Thank you, Sachiko.
Thank you. Yeah.
Yeah, thanks for sharing your story, and I hope that it inspires people to, advocate for themselves, no matter what is going on in their pregnancy, and that they can come to decisions that they feel really confident in before they go into labor.
Yes, thank you. No, I've always been really, really happy that I was able to give birth to both my girls in Canada. So thanks for the opportunity to talk about all this.
Yeah, super. Thank you. And thank you for listening.